All right, I get 5 minutes because I'm from family health care. No, I'm kidding. All right, so family health care is currently implementing a program that we believe is going to change the way healthcare is provided. Now, I'm going to tell you why, but first I want to take a quick poll. How many people in this audience have ever been to the doctor before? Yep, that's what I thought. Everybody. I think everybody. Have you never been to the doctor before? 271-3344, family health care. All right, so those of you that raised your hand, how many have ever had to sit in the waiting room, sometimes for several minutes, and then sit in the exam room for several more minutes waiting for your provider? Raise your hands. I'm raising my hand too. This is crazy. Look around, you guys. Everybody's waiting around at the doctor's office. Okay, so what we're doing at family health care is something that it's a question I've wanted answered for quite some time. Now, instead of waiting around, what do you guys think about filling that time, seeing an additional provider that's an expert in their field? Stand up if you think that's a good idea. I'm going to play off of Melissa's pitch a little bit here. So everybody thinks this is a good idea. Good, I can keep going. Whew, all right. So now those of you that are standing, I want you to hear this out. I think that this is a big problem, and I think people who come to the doctor's office are waiting around doing nothing too much. So what are we going to do to change that? Here's our innovative program at Family Health Care. When you come to the doctor, instead of waiting around in the waiting room, waiting in the exam room some more, only to see your provider for 5, maybe 10 minutes, instead of doing that, our program involves coming to the doctor, being roomed by your nurse as usual, and then you immediately get to see a clinical pharmacist, me, who gets to focus on your medications and chronic disease prevention. Immediately followed by one of our clinical dietitians, Vanessa, who's also a diabetes educator, focusing on lifestyle and diet interventions. And then you get to see your doctor all in one exam room. Okay, now before I go on, one more quick poll. How many people in the audience are healthcare providers or in med school? There's quite a few. Good. So now that I've seen the patient for 20 minutes, taken care of their medication-related problems and recommendations, Vanessa's taken care of their lifestyle recommendations and diet issues, what's left for you guys to do? Well, the answer is the providers have the rest of the time to spend high-quality time with you, the patient, providing high-level, complex decision-making that you were trained to do in med school. And so we think this program, through a multidisciplinary, patient-centered approach, is going to improve health outcomes. It's going to make people happier. You're going to leave the doctor's office feeling like you actually got some stuff done today. And we think it's going to live up to our mission, the part of it that talks about providing exceptional quality health care. All right, so we're right up the street. Stop in and say hi sometime. All right, thank you. Everybody dance now.